Yeah, very good morning, respected chairpersons and one and all present here. I'm here to present my study on ocular effects of visual display terminals in preschoolers, the digital bomb. Sorry, it's not working. Excuse me? Now it's working. So I don't have any financial disclosures to state regarding this presentation. So we are moving towards an era of tech-savvy kids and the toddlers, and this has become a silent pandemic, a public health issue of global importance. So the increased device use increases the demand on the immature visual system, and this cognitive demand causes a decrease in the overall blink rate, which is responsible for eye strain in these kids. According to the study that had come up last year, among the Indian children aged 10 to 14 years of age, the use of smartphone was found to be 7% above the international average. So we conducted this study to evaluate the effect and association of the visual display terminal users with the different ocular problems in the preschool children. So ours was a preschool-based cross-sectional comparative study conducted in Central Assam from January 21 to December 22, and the data was obtained from 550 parents of both private preschools as well as the government-run Anganwadi centers. Our study was approved by the Hospital Ethics Committee of our hospital. So we included only the children whose parents had duly signed the consent form, completed the questionnaire, and gave the consent to undergo comprehensive eye evaluation and had access to some form of visual display terminal. So we excluded the children with past history of any ocular surgery, congenital eye disease, and other systemic illnesses. So we gave the parents semi-structured and self-administered questionnaire to find out the socioeconomic data, the patterns of VDT use, and the ocular manifestations that could be associated with it, and the statistical analysis was done by using SPSS program. Out of this 550 students, 420 were from private schools and 120 from the government-run Anganwadi centers, and the age range of the kids was from 1.5 to 5 years. So there was no discrepancy among the sex distribution of the cases, but if we look at the above two pie charts, we see that the maximum age group was 2 to 3 years. That was the time when they were just starting the preschools, and the parents were actually giving the gadgets as the video pacifiers for the kids. And slowly, as their schooling period increased, the hours they spent on the screen, gradually it reduced. So among the VDT users, we see that the VDT users, the most common gadget was obviously the smartphone, and it was directly related to the affordability of the parents. If we look at this chart, we see that a huge number of these kids who were less than 5 years were using this gadget since the last 1 to 2 years. And most of them, they were defying all norms, all the recommendations of IAP and AAO, and they were using it for around more than 4 hours every day. So the symptoms were also there, and the parents were in most cases not aware of the symptoms. Parents basically came to us with frequent blinking, kids complaining of eye rubbing. But these kids also had problems like headache, eye fatigue, and burning sensations, which were overlooked by the parents. So we introduced a screen time tracker that was given to the parents, who at the end of the day sits and records the time the kids were spending in front of the screen. So with this screen time, what happens, there was healthy competition, and at the end of the week, the teachers used to assess who were the best performers in terms of the least screen use. And significantly, we noticed that there was 84% reduction in the use of the screen after 1 month, and maximum reduction was in the second and the third week after using this scorecards. So we also conducted workshops and interactive activities, and especially for the working parents to go back home, and at the end of the day, we have the smartphones are equipped with the screen time use, so we can assess what are the apps they are looking at and for how long. So just to conclude, we are dealing with a silent pandemic. We, as the ophthalmologists as well as the educators, we need to be aware of this situation. Ours was a single center study that was conducted in Central Assam. We need to highlight this study and extend it to more areas, because we have studies with young adults, we have studies with teenagers, but not with the preschoolers who are just starting their play schools. So modifications in the monitoring cards are still underway, and there is definitely scarcity of research in this field, but it will definitely help the policymakers, especially in the education and the health sectors, to provide the specific guidelines and more strict guidelines so that we can prevent this digital eye strain in these tiny kids and bring out the smiling faces in all the children. So these photographs, all the photographs used here has been taken with the consent from the parents. Thank you. Thank you.
Excellent. Yeah, excellent presentation. And in the interest of time, we'll skip the questions.
Thank you.
Yeah.